everyone, and welcome back to RN Info, the place where you get clear, reliable information on health topics. Today, we're going to be talking about diabetes. Quick joke before we dive in. Why did glucose go to school? To get an A1C. Okay, now let's get right into our topic for today. So, we'll be covering what diabetes is, type 1 versus type 2, risk factors, symptoms, complications, diagnosis, and how the condition is managed. What is diabetes? Diabetes is essentially a condition that affects how the body processes glucose. But to really understand diabetes, we first need to understand how the body normally uses glucose. Glucose is our cell's main source of energy, and it comes from food and drinks we consume. Once it's released into the bloodstream, the pancreas responds by releasing insulin, a hormone that acts like a key, unlocking the door for glucose to enter cells. This is what brings blood glucose back down to a normal level. Now, let's look at type 1 versus type 2 diabetes. In type 1, the immune system mistakenly attacks and destroys the insulin producing cells in the pancreas, which stops or significantly reduces insulin production. Without insulin, cells can't absorb glucose, so it builds up in the bloodstream, a term called hyperglycemia. Type 1 is most commonly diagnosed in childhood, though it can be diagnosed at any age. In type 2 diabetes, the pancreas still produces insulin, but the body's cells don't respond to it effectively. Basically, the lock and key don't quite fit anymore. This resistance still results in elevated blood glucose levels, but type 2 is typically diagnosed in adulthood. Now, when it comes to risk factors, we have the non modifiable ones like genetics, family history, and hormonal imbalances, and then the modifiable ones like obesity and physical inactivity. Moving on to symptoms. The three most common signs of diabetes are known as the three P's. First, polyphagia, which means increased hunger. Because the cells aren't getting the glucose they need, the body just keeps sending hunger signals. Second is polydipsia, or increased thirst, driven by a high glucose level in the blood. And third is polyuria, meaning frequent urination, as the body tries to flush out the excess glucose. These last two actually tie together. The more you urinate, the more thirsty you become. And because of the high glucose content in the urine, this can sometimes also lead to yeast infections. Other symptoms include fatigue, unexplained weight loss, and slow healing sores. Again, because those cells aren't getting the glucose they need to function properly. In terms of complications, type 1 diabetes can lead to what we call diabetic ketoacidosis, or DKA for short, a serious medical emergency. Type 2, on the other hand, is associated with hyperosmolar hyperglycemic state, or HHS, which is also a medical emergency. Both will be covered in a separate video, so watch out for that. Beyond these, uncontrolled diabetes can lead to heart problems like coronary artery disease and heart attack, as well as nerve damage, kidney damage, and even vision loss. Moving on to diagnosis, a fasting blood sugar test requires no food or drink except water for at least 8 hours, and it helps establish a baseline blood glucose level. The normal range is between 4 and 7 millimole per liter. Then there is the HbA1c, and if you remember the joke from the beginning, now you know why it came up. This is a blood test that reflects average glucose levels over the past 2 to 3 months. A normal result is below 6%. A result of 6.5% and above indicates diabetes, and anything in between is usually considered pre-diabetic. Now, let's talk about managing the condition. Diabetes management involves several approaches. First, regular monitoring of blood sugar levels. This is critical because knowing whether blood sugar is too high helps prevent those complications we talked about earlier. It also important for patients on insulin since they are at risk for hypoglycemia, and monitoring helps guide when insulin should be given. In terms of medication, oral medications like metformin are more commonly used for those who still produce insulin, so typically type 2 diabetes. For type 1, however, the primary treatment is insulin therapy, since those patients don't produce insulin. Diet also plays a key role, particularly a carbohydrate controlled eating plan. And lastly, regular physical exercise, which helps improve the cell's sensitivity to insulin. Okay, now we're just going to go through a few questions. Firstly, what serious medical emergency is specifically associated as the main complication of type 2 diabetes? If you said hyperesmolar hyperglycemic state, that's correct. Second question, what is the primary difference in the body's response to insulin between type 1 and type 2 diabetes? The answer is type 1 involves a lack of insulin production, while type 2 involves an ineffective cell response to insulin. And lastly, what is the primary physiological mechanism that leads to elevated blood glucose in type 1 diabetes? The immune cells destroy the insulin producing cells in the pancreas. Okay, that brings us to the end of this video. If you found it helpful, make sure to like and subscribe. Let me know how many questions you got in the comments, and I will see you in the next one.